We want to welcome you guys tonight to our Life in Quarantine series through Heartland. I've got some really awesome guests with us tonight, and we want to welcome our guests. And so just let's do an introduction. If you want to go first, Amanda.
Okay. I'm Amanda Mitchell. I've been with Heartland for, I think it's almost 13 years.
Wow.
Isn't that crazy?
That is.
I actually just finished my nurse practitioner, passed boards. I am out in the real world starting very soon and looking for new and exciting things, but more to come. Been a nurse for 12 years, so.
Awesome, and a good one at that.
Thanks.
All right, Zach.
Yeah, my name is Zach Crow. I am married to April, Kevin and Sarah's daughter. And so I've kind of been around for a few years at Heartland. We live in Ellendale, and we are on staff at Trinity Bible College. We were there formerly as students, and we've been on staff for a few years now. I actually just graduated as well in the same degree that Ethan graduated with, a global theology degree.
My name is Sarah, and I am pastor's wife at Heartland, married to Kevin, and I'm also the volunteer coordinator there, and I'm also a nurse. I'm an RN, and I work at Sanford Health. Just coming together tonight to talk about how to be healthy in a quarantine situation in a pandemic. How to be healthy spiritually, physically, and emotionally. So we're going to talk about that in a few minutes. But first, I'm going to ask you guys, what has changed in your lives since the pandemic?
I would say the biggest thing would be the social distancing. Not having the ability to just, I always say people watching. That sounds terrible, but I'd go sit at a coffee shop and read or study and things like that, just to kind of get out of the house. Yeah. Or go out to eat. That's I feel like it's a big North Dakota thing where you just go out and, meet people and then in addition to that, the workflow has really changed. I'm going to work now and going in early because I need to change into other scrubs. I can't wear my own clothes into work. I have to wear a protective equipment for 12 hours at a time. I'll get into that a little bit, but it's really different for a healthcare provider perspective, even as nurses. So restricted travel. I don't get to see my husband as much. He is home right now, but he said the airports were dead, just absolutely dead. And it's a weird, eerie time. I'm nervous about our economy and things like that. I've noticed, a lot of small businesses struggling, and even big businesses like where I work, laying off employees, 500 at Essentia. So
wow. It's unbelievable.
The biggest change for me has been, being on staff at a college. The classes, it started off with a 2-week, we're going to go online for classes, and then that turned into the whole semester. So that kind of changed. Really, it was half of a semester that just became completely online. So, for students, it's been huge. And for staff as well, it's meant transitioning in work and going online and having lots of Zoom meetings every week. And just learning to do things through different methods. And still trying to keep up on having contact with students and that sort of thing. Because now the added challenge is a lot of students maybe are not really feeling like they're in school anymore at this point. And so it's just keeping things moving has been a added challenge, I guess.
That's good. Yeah, that's a good point. It's affected all of us in different ways. For me, I guess I'm home a lot more, which I like, but I'm not in the sake of people getting sick and dying. I don't like that part. But I like being home more. I feel like life is slowed down a lot, and so we can't even meet at the church, and I'm still able to work, but I'm working less hours because there's less people coming in. They just don't show up now. And so, and when I do work, we have to wear the protective equipment. And so that's different for me to wear a mask and a shield on my face during the day if I'm in contact with anyone. And just a lot of sanitizing and cleaning at home and at work, and being more aware, just wearing a mask when I'm going out to shop. Just really, it's really different. And then trying to stay connected, like you said, Zach, with people via meetings and texting and Facebook instead of seeing people in person. It's very different. But I feel like for the most part, the people I've talked to are doing really pretty well with it, and making the most of it. And so moving on, we're just going to be
I forgot to mention that I'm also now a 5th grade teacher, and I'm not a very good one. So
yes,
I'm sure a lot of parents are in that boat too.
I can't imagine. No. Yeah, teaching kids and being a parent and having to teach, oh Lord. No, that's a whole another challenge for parents. Oh my goodness. So high five to all you parents out there that are trying to do this. And well, if you have to, you're forced to, basically. But way to go. And so Amanda, would you kind of just give us some background on the COVID-19, and as a nurse practitioner, just some background on that.
Sure. So just as an FYI, there's daily updates on the North Dakota government website. So if you want to stay on top of current numbers and things, that's where you should go. So this COVID-19, it's caused by, it's called SARS-CoV-2. So it's a severe acute respiratory syndrome. There was a coronavirus which caused SARS in 2003. So my junior year. I remember that, but it wasn't like this. It's odd. It's transmitted through airborne droplets, so coughing, sneezing, respirations even, which is why Sarah and I have to wear the PPE we do, or through a direct contact. Think of the surfaces you touch. The mean incubation period, which is the time it takes from the contact to when you show symptoms, is between 4 and 7 days. And really, it can be as long as 14 days and as short as 2 days. Usually it's about 5 to 7 they're really seeing. Okay. The scary part is that the virus can be shed for roughly 20 days after your illness starts. So even that 14 day, you're, should I go to work? Should I not? You're actually most infectious when you're at the peak of your symptoms. It can still be transmitted person to person when you're asymptomatic. And that's kind of what happened up in Grand Forks at the LM plant. And you can even have patients that are admitted to the hospital that need placement. And in order to be placed, they need to be tested for COVID. We've had cases where, hey, they have COVID. They didn't even have symptoms. Oh, okay. So then you're really scrambling. So, so these symptoms, they usually include mild respiratory tract infection, like you feel like you have a cold, dry cough, fatigue, low-grade fever. A lot of times they say a loss of smell.
Yes, I've heard that. Yeah, interesting.
Yeah, there's even some that just have, especially kids, they more so can have like gastrointestinal complaints or diarrhea, nausea, vomiting, where it looks like a gastroenteritis with some fever. So it's all over the place. So it can progress to respiratory distress, requiring you to see me in the ICU. Fatality rate is 1.8 to 3.4% of those who get sick. Okay. Your risk factors are greater if you have comorbidities like asthma, COPD, diabetes is a big one. Keep your blood sugars in check. AIDS, because that affects your immune system. Congestive heart failure. Smoking is a big one. Increased age over 50. They're even saying 54.
Ooh, I'm 55. Uh-oh.
Yeah, it's not as
I know.
yeah, but
But it seems like it's getting lower at the age where you might be at risk.
there's we've had an infants a few infants now die of it, so it's different. So that's a little bit of background on COVID.
Have they mentioned, I know you said smoking. What about vaping? Have they said anything about that?
Same, you're damaging your lungs.
Okay.
Yep.
Okay. That's what I was
Yep.
thinking. So
Hmm.
thank you for that background. I appreciate that part because just the information, I think it's good for us to know. Our focus tonight is on how to stay healthy during the pandemic. We are three parts as people: body, mind, and spirit. The body, of course, physically, what we live in. The mind, or emotionally, we say in our emotions, or spiritually, how we connect with God and that part of us. It's all real, all three parts. And so it's important that we are healthy in all three parts. I'm going to turn it over to Zach for a few minutes to talk about how to stay spiritually healthy during this time.
I mean, we all have our own spiritual life. I mean, as communally as Christians, but also as individuals. And we all probably have different ways of expressing that spiritual life or living it out. We have like norms or things that we do to kind of fill our spiritual tank. There's been like an obvious big change in like a lot of people's lives, whether that's like with employment or like with social distancing and quarantine, like being in your house a lot more is requiring like some new normals for us, at least for a temporary time. So I think it's just requiring of us to kind of examine like what do those new normals need to be for me right now, and like as an individual or for your family. For me, I guess I've been like home a lot more, with my family a lot more, which has been really great. Something that's been important for me is like short moments of solitude throughout the day, finding moments to be alone, like finding moments for just like moments of quiet, moments of peace. And I'd say it's been similar in like just spending time in God's word. It's kind of been like moments throughout my day, just finding times to like be by myself, or maybe even it's with my son, he's playing and I just kind of sneak off to the side for a bit and just find moments of refreshing.
Yeah.
And so that's kind of been a new norm for me. And I think it just takes each person to examine their situation and just practically think through like, well, what can this look like for me? What do I require like to like fill myself up spiritually?
So did you feel like, Zach, that has changed much for you or is your spiritual health basically kind of stayed the same during this time?
Maybe one advantage, I guess, is I think I've been more reflective lately.
Okay.
My faith journey, years past, and my walk with God, I've been reflecting on that. And I've been examining like where I'm at in my faith right now, both good and bad things.
Sure.
And then I've been looking towards the future as well, and just contemplating like, what direction is my life going and where is God taking me and my family.
That's good.
I think that's been a little bit more, I've been more reflective.
Yeah, as far as me, I feel like I've just been, I feel like it's a lot the same. And so I'm just still listening to the word in the morning. I listen to the Bible every morning for about half hour, 40 minutes. And then I'm really into worship music. So I have music on pretty much all day. As far as an outlet for me, I've been trying to connect with God and with others, through my workplace, just being really open and talking to others about the Lord, and continue to pray for people, and just keeping on, not slacking off because we're home, or just not. We don't want to get lazy in our faith during this time. And so, Amanda, do you have any thoughts about this?
My husband is a pastor too, just down in Arkansas. I joke that that's how he tolerates me, but that's not the reason. I always find it interesting, just being at work, how many people's lives you touch, and how you can add a conversation of God into anything, right. Especially now when if I have a dying patient, they can't have anybody in their room. Nobody can have a visitor unless they're dying,
Yeah.
and they get an hour, and
Oh,
there's 2
wow.
people that can see them.
Wow.
So, and it's not just where I work, it's a lot of places, and
Mhm.
it's in place to protect people,
Right.
and our patients. The last weekend I worked, I had the opportunity to be in the room with the pastor as she was giving last rites. And this family only had an hour, and just to be with them and to pray with them,
Yeah.
it was an honor.
Yeah.
And, you know, just bringing in a little happiness, and just a little bit of faith, it really does help.
It does.
So, and I have a lot of friends and acquaintances who have reached out mental health, wise, that say, I miss going to church, and, this and that. It's interesting how God uses you in your role.
Yes.
It's
Absolutely.
pretty cool.
It's really.
Yeah, it is. It's, yeah, Godsome, as my husband would say.
That's what I love about being in healthcare. I feel like
Mhm.
the door is swung wide open, and even where I work at Sanford, they're like, you can pray with people, and we can talk to people as long as we ask permission. And so I think it's every chance we get. God is not a separate entity when we're out in the workplace, but He is part of us, and that should be every day, touching someone and being Jesus to others. And what a great story. I'm so thankful that you were there for that moment. And so I believe God is wanting to use all of us during this time, and in very unique ways sometimes. So it's really exciting. And that's the thing, we're not alone. God is with us. He's walking with each of us in our situations. And so we're all in different places. Those of you that are listening to, we're just all in different spaces where God wants to show up and minister and be part of our lives as well as others. How about physical? What kind of things can we be doing right now physically, that means the body we live in, to stay healthy and not get lazy? We were tempted, Zach and I were tempted to get a bunch of bags of chips and like empty brownie pans and set them around us and like junk food everywhere. And that would not be the way you would want to do this quarantine, because we would all walk out of it very unhealthy. And so that's not what we want to do. So how about you guys? What are some ways that you would encourage others to stay healthy physically?
3 main points come to mind: exercise, diet, and sleep. And those are all really important aspects of our lives. We all sleep, we all eat, and we all have different levels of activity in our lives. And I know with like being quarantined, being in your house a lot of us might be in a lot more sedentary type lifestyles right now. So that needs to be made up for in some way. A few weeks ago, I was finishing up a big paper, my thesis. And so I was doing a lot of sitting and writing. And so I made sure to go on a long walk every day, not just being active, but like getting outside, getting some fresh air, not just being indoors all the time. So I think that's good for us mentally as well. And then quite a bit of exercise. This has been one of the bigger changes, I guess, for me, is not being able to go to the gym. Because it's also a large hobby of mine. So it's beyond just fitness for me, but I have fun with it. And so I haven't been able to go to a gym. So I've had to make a lot of adjustments, buy some gym equipment, and just program my own workouts and come up with a new system and a new way of doing things so I can stay active.
Right.
And stay pursuing like my fitness goals. And again, we all have different fitness goals. Maybe it's just like I want to get like breathing heavy and sweating once a day or something.
Yeah.
Maybe you just want to go on long walks. We all have different goals, but
right. What were the 3 things again? Diet, sleep,
exercise, and sleep.
Those are good. Not everybody gets enough sleep, and that's really important in healing. I know that exercise is the best antidepressant ever. You gain the serotonin and dopamine lift in your body and your brain for, I think it's up to 2 days, like 48 hours or something, if you do a good workout. And so that's a natural way to lift up your emotions too. And Amanda, how about you? Anything on your end?
I think of, right now I live in an apartment. I'm on second floor. Nobody's going to want me jumping around doing my beach body workouts, right?
Right.
Who I worry about most is our kids who are used to having gym class, who are used to having recess, that are now forced, they're not able to be outside playing with kids. So as parents and for ourselves, to stay healthy as far as diet and nutrition go, have times where you're trying to move, even if it's going for a walk or going out, and like Q, he went and flew a kite yesterday, I should say. It's balancing too. So for all of us that are stuck at home, it's making sure we have the routine. So even though you're at home, you don't have school necessarily,
Right.
You want to get up at the same time each day.
Mm-hmm.
You want to have a plan for your day. Schedule your meals, plan your meals. And that way kids and adults aren't just grazing all day. It's really easy to do, especially mental health wise. It's, you're reaching for comfort. Mm-hmm. And then maintaining the same bedtime routine. Your sleep and everything is tied to routine. Yeah. So if you're off track, I was rotating nights and days and had a sleep medicine evaluation or appointment, and even myself at 34. And it was just hammering down those basic things, and I know better, but it's odd times. Avoiding any unnecessary contact, that keeps you healthy too.
Right.
Make those lists. Make sure you're not forgetting, oh, I forgot a loaf of bread. I forgot this and that. Make one trip. Hand hygiene, that's going to keep you healthy too. Washing your hands, 10 times better. If you doubt your skills, look on the CDC. They have some different fun videos, but most of us don't wash our hands right.
I didn't think I was like, oh man.
Yeah.
I've been wearing, I order bulk surgical masks from online. And so I just have them in my car, have them in my house, and I give them to people if they need them. I feel like I have this mask ministry now. I just give them out to people. I'm like, do you need a mask? They're like, yeah, because I feel like people don't know where to get them. And so if you're a medical person, we're required to wear a certain kind of mask. But if you're just like going shopping, there's a lot of people making pretty decent masks right now that can keep those particles, those respiratory particles from entering your mouth and nose.
Yeah, it keeps the bigger particles out. Yes. Yeah,
but not the tiny ones probably, but
right.
It's better than nothing. And so
making sure you're washing them if they're cloth.
If you have the cloth ones, wash them in, and then I think hot is better because it kills the bacteria. And then also in doing that on a daily basis. Surgical masks, I wear those going into stores. I don't shop without one now. They say wear them multiple times, but then just turn them backwards when you store them in a bag or something like that, away from everybody else.
We actually use the shallow square Tupperware.
That'll work. Yeah, that's a good
idea. So you take your mask off, you put it down, then you put the lid on, and then once you're done, you can take it, put it back on, and you wipe out the container. It's pretty slick.
That's a really good idea. Thank you for that tip.
As far as cleaning wise, everything has contact time. So if you're looking at your bottle of, say, Lysol, you need to see how long it takes before that surface is actually, clean. Read your labels.
Let's go on to the emotional side. It's really kind of a grieving process where people have lost opportunities. Maybe they've lost a job. Some people have lost their loved ones because of this virus. Maybe others are having loved ones in the hospital that they can't visit. There's people that started new businesses that this all shut them down right away. You know, concerts and piano recitals for kids and families and outings and all kinds of events and graduation. Just think of that. All the graduates, I feel really bad. We're all experiencing some portion of loss in our lives right now. And how we handle that is really important. When you talk about grief, there's like, you know, we hear about the 5 stages, you know, the isolation, being angry, bargaining, depression, being accepting of it. That's the positive side. They don't always occur in the same order. What are your guys' thoughts on grieving during this time and how this is affecting people?
We've seen a lot more people needing to come into the hospital. We have a lot of the patients that are suicidal or attempted to commit suicide. So those that have already have mental health issues, they're having that sense of loss, or they're if somebody's very codependent on others to make them happy kind of thing. Not an introvert like myself. But even for somebody introverted, it's weird. It's not, people are meant to be around other people. And that's where it's important to take care of yourself and learn how to cope with stress. If you're not able to go out, if you're not able to, say, window shop, you can't do this or that, it's a break in your routine. It's you're taking something away, you're being told no. Everybody's going to react so differently, just like we all react differently in a stressful situation.
Right.
So, and those responses, they can change depending on your background. Ones I really worry about are actually our kids. They can have more somatic symptoms where they're kind of turning internally, and they can't play with their friends anymore. They don't have things to do, then they drive their parents crazy.
Right.
I
think we just need to be just available. Someone just to listen to each other and just say, man, I'll pray can I pray with you? Can I, you just, you can get a hold of me, or just making some kind of contact. Zach, any thoughts on maybe how God comforts us during these times?
I mean, a lot of it just requires us to be trusting him with our lives. And like we've been saying, different people are facing different scenarios and issues, whether it's financial or maybe just their family dynamics within their household is like high stress right now. We need to have lots of grace for one another, because like we said, we don't know how other people are handling their emotions or processing things. So be gracious, and faith doesn't stop just because life's been put on halt.
Great. That's good.
I think it gives us a different perspective too of what's really important. You take away the worldly things, and then you're faced with the reality of yourself and God. For myself, it's, wow, I have this opportunity to just not be busy. And I'm the queen of being busy.
You are.
Yeah.
Yes. I have appreciated that also. And I felt really thankful to the Lord. I think sometimes he allow, of course he knows what's going on. I'm not saying he caused this, but he knows what's happening. But I think he wants us sometimes just to stop moving for a period of time and just like, oh, wow, life isn't just all about running here, clocking into work, going home, making supper, doing this, doing that, making all these meetings, you just like, and we're just like crazy. I am feeling so much more refreshed and healthier as a person. You said perspective. Let's look at it in the right perspective. This is happening right now. Let's make the best of it. Let's take care of ourselves. Anything you want to say, just the last few sentences before we close, you guys.
I guess if anybody has any mental health needs, or they have any questions or concerns where they just don't know who to turn to, I know I'm always available. I can answer my phone. You can text me. email me. If you don't have my number, you can get it through Sarah, or she can even post it on our website kind of thing. So
Awesome.
I just like to put that out there. So
That's great. Thank you, Amanda. How about you, Zach?
I would just conclude with saying, with a lot of our lives being put on halt in a lot of ways, just remembering that what we do, like, that's not the full substance of our lives.
Yeah.
And that's not like the full view of how God sees us either, by just what we do. But he sees our hearts and our hearts towards him. And if anything, that's more important to him. And that's something that is not taken away from any of us right now.
Right.
It's something that we continue to grow in. We can grow in our love for God right now. And that's important to him. So.
It is. That's great. And I just want to close with a scripture. It's out of 2 Corinthians 1:3-4. It says, "Blessed be the God and Father of our Lord Jesus Christ, the Father of mercies and God of all comfort, who comforts us in all our affliction, so that we may be able to comfort those who are in any affliction with the comfort with which we ourselves are comforted by God." And just to remind us, let's just be comforting and encouraging to each other. As God comforts us, we can comfort others. And so we're not alone in this. We're going to get through this together. And with the Lord, he's right here with us. So if you need anything, reach out to us. I would love to pray with you. Amanda's would love to help you in any way. If you're struggling, Zach is available. Our church, our pastors are available. So we just want to just put ourselves out there for you guys, and we want to help. And so we want to thank you for joining us tonight. I want to thank Amanda and Zach for their input tonight, and appreciate you guys so much. And so we just want to say thanks again, and God bless you guys, and good night.